Excellency, the Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, the President of the Pharmaceutical Society of Kenya, together with your officials and all the members, the President of the International Society of Pharmacists, or Pharmacop, I didn't quite get it. Who else is here? My Deputy Director General, Dr. Matende Chere, senior government officials, my colleagues and friends, and all the members of PSK, good afternoon. Good afternoon. Thank you very much, Your Excellency. It gives me real joy to be here with you today to preside over this 60th anniversary celebration for PSK. Ideally, Your Excellency, I'm supposed to be a member of PSK. If it was a political rally, I would have said my opponents. But gladly, I don't have opponents here. I want to believe it's a technical hitch. Your Excellency, I was saying, ideally I'm supposed to be a member of PSK, but apparently my education was not recognized, and therefore Dr. Sioy and company did not register me to practice. But you know, God works in miraculous ways. And now that we are here with you today, and I know in cabinet we passed a resolution on recognition of prior learning. Your Excellency, I would like to direct COE to give me my practicing license so that I can be recognized. But anyway, that is on a light note. I'm really pleased to be here with you. And I want to say that this government, really, Your Excellency, has recognized the health sector and specifically the subsector of pharma. Your Excellency, in this government, we have a whole state department of public health and professional standards. And that is your home, you as professionals. So that is recognition number one. Number two, Your Excellency, under my leadership in the ministry, for the first time, we have a Deputy Director General who is a pharmacist. And the third thing, Your Excellency, is that we now have a Directorate of Health Products and Technologies, headed by one of your own, a pharmacist. So I believe, Your Excellency, that we are in the right direction. We have recognized the pharma subsector, and because I know that we cannot drive this healthcare forward without your participation and without carrying you along. Your Excellency, we have continued to have very good collaborations with the Pharmaceutical Society of Kenya. I have hosted the officials in my office when there was a lot of discussion on the KDA bill, and we put our heads together on what is now in Parliament. I know as it goes through the process, some of the things get dropped, others get added, but we'll work together to ensure that at the end of the day, we get a good bill for this country. Your Excellency, also as a first, it is during this government's time that we now have a formulary. We did not have it. It is during this time that we have one. And I know the director is now working on ensuring that we get a catalog so that then some of the issues that you have raised on scheduling and all other products, then we can, from the catalog, then we can determine even the benefits package for the pharmacy. Your Excellency, moving forward, we are working very hard on implementation of universal health coverage. And one of our key pillars is on health commodity security. And that is the supply chain that the President talked about, the issue of quality, Your Excellency. This is where we take care of it. And I'm happy that so far we have done governance reforms at KEMSA. It is not operating optimally, but I know with the efforts that we are putting in place, we should be able to operate optimally. The other thing under health commodity security, Your Excellency, is the issue of local manufacturing, which you are passionate about, and I will let you to speak about it. But of importance to this team is our achievement of maturity level 3 for the Pharmacy and Poisons Board. And I think we are on track. Dr. Sio is here. We have talked in the morning, and he has assured me that we have an assessment in July, and he knows that he has done what needs to be done. Your Excellency, the other thing that we are focusing on under our pillars is our health professionals. I keep saying we can have all the best infrastructure, good hospitals. We can have the best equipment, but if we don't take care of the people to use the equipment and work in those facilities, then we'll not be able to provide the required health services for our people. So we are working together with these teams. And Your Excellency, now we are at the stage of implementation of our Social Health Authority. So as I stand before you, esteemed members of PSK, is to ask you of your support for this. And there's something in it for you. One of the things that we have done that previously was not there with the NHIF is the empanelment of pharmacy services. That now community pharmacies are going to be part of the primary care network. You are going to be registered as a service provider. And that is very important. So in this Social Health Authority, there is something for you, especially those who are running community pharmacies. So I want to call upon you to support us, because then you are the people who are going to fill the prescriptions. Remember, we have a special fund, the Emergency Chronic and Critical Illness Fund. And you are the people who are going to fill those prescriptions. Before I invite you, Your Excellency, I would wish to make a clarification. We have SHA and we have SHIF. We have a law, the Social Health Insurance Act of 2023. Is the one that gave birth to a body called Social Health Authority, the umbrella. The Social Health Authority has 3 funds. It has the Primary Health Care Fund, where Kenyans can access services at level 1, 2, 3 without having to pay out of pocket. Then we have the Social Health Insurance Fund, where we are saying you are required to pay 2.75% of your income. And I want to assure you, we'll make good use of it. And we have a third fund, the Emergency Chronic and Critical Illness Fund. I thought it's good that I clarify it to you so that then you are sure what is SHA. SHA is the house, and under the house we have the SHIF, the fund. I would now like to request you all to be upstanding so that we welcome His Excellency, the Deputy President. Can we put together our hands for him? Clap and clap and clap, 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 clap until he gets here. Clap harder, clap harder. And you know, I still stick to the mantra.